Measles was declared eliminated in the United States in 2000, meaning it was stopped from spreading freely. But that's no longer the case. As of April 2nd, 483 cases of measles have been confirmed nationwide just this year. 422 of these have been in West Texas, where one child has died from the disease. Measles is among the most contagious viruses known, and it can lead to serious complications, including permanent disability and death. And yet, health misinformation, which reached a critical mass during the COVID-19 pandemic, is driving vaccination rates in the United States ever lower, leading to outbreaks like this one and threatening the public health gains made possible from decades of vaccination. On March 26, Dr. Peter Hotez and I discussed how we got here and what we do now at a Baker Institute event, which we're sharing a truncated version of for the podcast. Peter is a fellow at the Institute, as well as a prominent vaccine scientist and physician. He's the founding dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston, where he also teaches pediatrics and molecular virology and microbiology. And he's the co-director of the Texas Children's Hospital Center for Vaccine Development, where he has led efforts to develop life-saving vaccines for tropical diseases common in low-income parts of the world. He's also a public health advocate who became a familiar voice and defender of basic science during the COVID-19 pandemic. His work is focused not only on medicine, but on promoting trust in science and public health and defending them against misinformation and political polarization. If you would like to watch the full hour-long event, you can click the link in the show notes. I'm David Satterfield, Director of Rice University's Baker Institute for Public Policy in Houston, Texas, and this is Baker Briefing. Thank you, Peter, for coming yet again to the Institute, where we are honored to have you
I'd love to
as
be
a
here.
fellow. As of today, and I understand these may be low figures right now, the Texas Department of State Health Services reports 327 confirmed cases of measles in West Texas, mainly in Gaines County, and one death. A week ago, the numbers were around 160. 23 people, mostly unvaccinated children, have been hospitalized in West Texas. Families are mourning, hospitals are strained, and public health officials are racing to contain an outbreak that need not, should not, ever have happened. So, Peter, what led us to this moment? What went wrong? What was predictable here?
Yeah, I mean, I had actually written an article in the Public Library of Science in 2016 called Texas and its Measles Epidemics, and which basically foretold all of this. I mean, it took a decade for it to become fully realized. So the point is, this was both predicted and predictable. And those numbers, by the way, are certainly lowball estimates, as you point out, because I think there's a number of kids not getting the medical attention they need, or moving to other states. And so between West Texas, neighboring New Mexico, Oklahoma, now there's a couple of cases in Kansas. I hope it's not moving north. It's maybe twice as high. There could be 1,000 cases easily, and there's at least 40 hospitalizations now. Measles is a bad actor, as we'll discuss. So why did this happen? It began because of what too often people call misinformation or infodemic, as though it's just some random junk out there on the internet. And it's not that at all, David, as we've discussed, Ambassador, that it's organized, it's deliberate, and it's politically motivated. It started with false claims in the late 1990s that the measles, mumps, rubella vaccine causes autism.
This was the famous Lancet article paper, that was then withdrawn.
That's right, by Wakefield and his colleagues at the Royal Free Hospital of London. And then over the years, there was a series of moving goalposts. So in 1998, there was the Lancet paper. The scientific community debunked it thoroughly with large epidemiologic studies showing that kids who got the MMR vaccine were no more likely to acquire autism than kids who didn't. And similarly, kids on the autism spectrum were no more likely to have gotten MMR than kids who didn't. And that should have been the end of it. But this is when our friend Robert F. Kennedy Jr. came on the scene in 2005 and wrote an article in that well-known biomedical journal called Rolling Stone that it must be the thimerosal preservative in vaccine.
The mercury-based.
The point is, they had decided a priori, they decided ahead of time that vaccines must be causing autism, and they were going to keep looking for what it was. And so then they came up with thimerosal preservative. The scientific community responded again. And then they said it was spacing vaccines too close together. So it became this exhausting exercise of whack-a-mole or moving the goalpost. And it got to the point by the 2010s that states started taking action. So because so many parents were not vaccinating their kids in California, especially Orange County in Southern California, Marin County in the north, that there was just like this, there was a huge measles epidemic. And measles is usually the first one you see, because you can see all breakthrough childhood infections, but measles you see first because it's so highly transmissible. So that's kind of the first signal that there's a problem. There was a big measles epidemic 2014, 2015. The California legislature then did the right thing. They shut down vaccine exemptions. They said, from now on, you want to send your kids to school, your kids have to be vaccinated. And I supported that. And it immediately solved the measles problem in California, but then it had a backlash in certain states, most notably in Texas. So Texas then became kind of the epicenter of the anti-vaccine movement, where it got tied to politics. And this is one of the things that we're dealing with. It's also the hardest thing to talk about, because as scientists, we don't like to talk about politics. But they started forming, from the Republican Tea Party in 2014, 2015, they started forming PACs, political action committees, to support anti-vaccine groups to work with the state legislature in Texas to file anti-vaccine legislation, to support candidates to run on anti-vaccine platforms. And we saw this very sharp rise in the number of parents choosing to opt their kids out of getting vaccinated. So now we have more than 100,000 kids not getting vaccinated.
Can I just interrupt for a moment to clarify for the audience? Texas policy, and this was policy in many states, allowed a specific substantively justified religious exemption from vaccines, some states. Texas has gone beyond that to speak of conscience-based decisions to exempt vaccinations as a requirement for public school enrollment, correct?
You're absolutely right. So almost every state allows exemptions for religious reasons, although if you think about it, there's no major religion that has prohibitions against vaccinations. So, but 18 states in this country allow vaccinations for reasons, some people call it personal belief, conscientious objector reasons, although I don't see anything conscientious about it. And Texas is one of those states. And we saw this then steep rise with at least 100,000 kids not getting their vaccines. And it's not homogeneously spread across the state. So of the 100,000 Texans who died in the COVID pandemic, roughly half, 40 to 50,000, of those deaths occurred after vaccines became widely available during the Delta and BA1 Omicron wave in 2021, 2022. 40 to 50,000 needless deaths occurred because people refused vaccines, targeted by those same anti-vaccine lobby, overwhelmingly in those same spots where we're seeing measles now in West Texas and in East Texas. The point being, this is more than an academic discussion, right? We're talking serious numbers of lives lost. I mean, 40,000 Texans died because of this thing. That's more Texans than died serving our nation in World War II. That's the depth and breadth of the anti-vaccine movement.
Peter, we're gonna go on to a discussion more broadly of what over the years, the decades, has been done to research allegations of connectivity to autism and the broader social question, why the autism diagnoses have increased and what the science is behind that. But I want to continue to focus on measles. 2 decades ago, in 2000, the U.S. declared measles eliminated, a victory of science, public trust, sound public policy, national, state, local level. Today, as you just described, we're in the shadow of an outbreak that threatens not just in Texas, but potentially elsewhere to undo that progress. what does this say to us more broadly about the state of public health infrastructure, policy, and the collective will of Americans to protect one another? What I do and don't do with my child, with myself, affects the health of others.
Yeah, absolutely. And you saw it really rev up during COVID. I think one of the lessons learned is how fragile our vaccine ecosystem. So those were hard-fought gains to eliminate measles in 2000, because to do that requires incredibly high levels of vaccination coverage, roughly on the order of 90, 95, preferably over 95% of all school-age kids need to be vaccinated. And that's a lot of work. And you see measles the minute you start declining significantly below 90%. That's how fragile things are. And it requires the work of the whole community, not only the state and local public health officials, but the schools have to be all in, parents have to be all in. So this is a carefully orchestrated dance to maintain that high level of vaccination coverage and community spirit and caring about one another in the community. So the fact that we've allowed it to break down like it has in West Texas speaks volumes, unfortunately. And the odd part, of course, is anyone who's ever been out to that part of Texas, it's I mean, I remember hearing once Laura Bush get interviewed from that part of the state, and she talks about how the kindest, nicest people you'll ever hope to meet, and she's absolutely right. But this is a predatory movement that's targeting those individuals.
Now, Peter, I'll switch to a bit of a personal note here. I almost lost my sight and hearing from a very severe case of measles. It's a serious, serious disease, and it can be fatal. So can you remind us in the most profound but comprehensible fashion, what does the vaccine do? How does it work? And how has it been tested over time?
Well, I think it's hard to beat how articulate you just were. You almost lost your sight and hearing from measles, right? Measles is a bad actor, and we now need to do a better job reminding parents about that. I mean, if you're unvaccinated, 20 to 30% of kids will require hospitalization because of measles pneumonia, measles encephalitis, neurologic involvement, hearing loss, blindness, and this is what measles does. The vaccine was actually co-developed by a former mentor of mine, Sam Katz, who at the time was at Boston Children's Hospital with John Enders, who was the first to develop the cell line that led to the polio vaccine. In fact, the only Nobel Prize given for the polio vaccine was not to Sabin and Salk, but to Enders, who developed the cell lines that cultivated those viruses. And it's a highly weakened virus, and it's not just measles, it's also for mumps and rubella. So we don't see congenital rubella syndrome anymore, which was another devastating condition. If you were pregnant and were unfortunate enough to be exposed to rubella, your child could have intellectual deficits, cataracts, hearing loss, heart defects. It's an awful condition. And so the virus is a live, attenuated virus. It has probably the greatest safety profile of almost any vaccine we have, and the highest effectiveness rate. In fact, I make vaccines. So at our Center for Vaccine Development at Texas Children's Hospital in Baylor, when we're designing a new vaccine, like our COVID vaccine that reached 100 million people, and parasitic disease vaccines, our aspirational goal is to make something as good as the MMR vaccine. That's how good it is. And we never quite get there. But that is the gold standard for a safe and effective vaccine. So to see it weaponized like it is very discouraging.
And let's talk a moment now about the MMR vaccine, which, as you say, for the last 25 years or more has been open to challenge. The scientific community did not simply deny the allegations. It took them and it researched. What's the history here of the various claims made against MMR as an effective and safe vaccine?
Well, one of the things that they do is they still push the autism narrative, even though that's been thoroughly debunked. And it never really made sense from my point of view, just from what we know about autism. So the way I got involved in this whole thing was, I have 4 adult kids, including Rachel. Rachel lives with us. She's an adult now, has autism and intellectual disabilities. And I wound up writing a book talking about Rachel's life called Vaccines Did Not Cause Rachel's Autism. And that's what maybe public enemy number 1 or 2 with anti-vaccine groups. And our good friend Robert F. Kennedy Jr. on his Instagram posting publicly labeled me the OG villain. And I'm so old and square, I had to Google what that meant, the original gangster villain. And you know, I'd been talking to him for over a year in 2017 at the request of the NIH, because they said, Peter, you got a daughter with autism. You'd explain why vaccines don't cause autism. We're going to have you talk with RFK Jr. And I couldn't engage him. But the point is, it's not just there's 3 parts to this, actually, Ambassador. One is the evidence showing there's no link between vaccines and autism, like MMR. That's very clear. But also, it's the lack of plausibility, because what we know about autism are the processes occur in early fetal brain development well before kids are born. And it happens through the action of autism genes. At least 100 genes have been identified, all involved in neuronal connections, synaptic connections between neurons, which makes a heck of a lot more sense than something like a vaccine. In fact, we did genomic sequencing on Rachel and my wife and I here at Baylor. We found Rachel's autism gene, which is similar to the ones first reported by the Broad Institute at Harvard, MIT. A little different, but it's the same kind of class. And now, on top of that, we have new assembloid brain organoid studies. The science is so advanced now, you can actually make little mini brains in the test tube with neurons that have autism genes and show the aberrant migratory patterns, actually reproducing it in the test tube. So it's really a complete story. It doesn't mean there's no environmental influence, but if it is, it occurs very early on in pregnancy. For instance, if you're pregnant and may not realize it, and you're taking a medicine called Depakote, which is an anti-seizure medicine, also known as valproate or valproic acid, that medicine will interact with your autism genes to give you an autism phenotype. Your child will be born with something that very much resembles autism. And there's at least 6 other chemical exposures in early pregnancy that can interact with autism genes that will do that. So one of the frustrating things I had with Robert F. Kennedy Jr., I said, Bobby. He was letting me call him Bobby at that point. I won't tell you what he was calling me. I said, Bob, we have, 6 chemicals. You're an environmental attorney, right? You say you're committed to, solving this autism problem. This is the stuff we actually know causes autism. You should be all over this thing. And I couldn't engage him. And that convinced me that he had another agenda in this, that he wasn't really interested in understanding autism.
And Peter, this leads us to the next question, very much in the public space. Why have autism diagnoses increased over the years as they have?
At least a component of it is changing the diagnoses. So now, for instance, we don't call it autism, we call it autism spectrum, because we've broadened the diagnostic categories around social interactions and that sort of thing. Also, the other thing that happened was in the early 2000s, the American Academy of Pediatrics made as a specific recommendation to pediatricians that you begin autism screening between 1 and 2 years of age. So those numbers really picked up quite a bit. So those were 2 of the biggest factors. And also, then as parents became good autism advocates, they were advocating for services in the schools, right, for special needs for the schools. And it got to the point where it still is today that if you wanted special needs, it was easier to put you into those programs if you had an autism or autism spectrum diagnosis. So that amplified it. So and then we also got better at diagnosing it in girls and women. So for instance, we used to say the ratio of autism from boys to girls was 10 to 1. Now it's listed as roughly 3 to 1 because girls and young women can camouflage their autism better. They're more verbal. Oftentimes their comorbidities would get diagnosed. So they would get diagnosed with ADHD or OCD. A lot of the teenage girls with anorexia and eating disorders may actually be on the autism spectrum. So that's being understood better. So that's another thing company associated with the rise. Also, better access to underrepresented minorities with autism diagnosis. So that probably accounts for the lion's share of the increase, all of those factors. But there still could be that environmental component. It doesn't, and that also needs to be looked at, and that's what's so frustrating. So when Robert F. Kennedy Jr. wants to now reopen the vaccine and autism link, and this was just reported in the Washington Post.
Yesterday.
And I said, oh my God, I mean, this is about as dead a horse as you can get, and yet he keeps on wanting to hammer away at it. Meanwhile, he doesn't want to do anything to help parents with special needs, with kids with special needs with autism. What about all the adults with autism and intellectual disability in the community? What are we doing for them? The answer is pretty much nothing. A lot of the time. What about that? What about all the environmental factors that may actually be triggering autism? What about fully understanding how autism genes operate, especially those associated with comorbidities or intellectual disabilities? Maybe there are things we can do to intervene. He's not looking at that. So he's pretty much, when I was a kid watching Monty Python, they had this one skit where the commanding officer was teaching the troops how to disarm a man with fresh fruit.
Yes.
And the troops said, no, we want to learn how to disarm people with guns and sticks. and he kept on pushing. So Bobby's pushing the fresh fruit, and the problem is, one, it has a chilling effect on parents' acceptance of vaccines, and has helped contributing to this measles epidemic and future ones. But second, it diverts resources, and we have this thing called DODGE, in case you hadn't heard about that. That's trying to limit government spending. So we're going to have more limited resources than ever, and those precious few resources are now going all towards phony baloney autism links. So that's a source of frustration.
NIH, CDC, National Science Foundation. How have the policy shifts, changes, reviews, suspensions of grants affected the work you do, Peter? Well,
it's, fortunately, a lot of our vaccine work is supported by private support and Texas philanthropies. But our young faculty, we have some NIH grants, so it will have an effect, but it's the young faculty that I really worry about, whose careers depend on NIH support, both through what we call K awards. These are first-time investigator supports, training grants for MD, PhD, and PhD programs. We are basically eating our young now in terms of our whole next generation of scientists. I don't know what's going to fill that gap. I have a paper coming out on Friday in the Public Library of Science, about young people and their careers in bioscience and how we start filling the gaps with biotech and private philanthropy, but it's not going to really address that gap. And this is one of the most important success stories our nation has had, is our biomedical research enterprise, our science enterprise, and yet to selectively choose to target that just makes no sense.
Peter, is this unique, the phenomena you have described? Challenge to basic science, specific challenge to vaccines and vaccination. Is it unique to the U.S.? Is it a global phenomenon?
It's starting to be a global phenomenon in the sense that now this U.S.-style anti-vaccine activism, that's the convergence of the health and wellness industry that's pushing ivermectin and hydroxychloroquine and vitamin A and everything else that doesn't work, together with libertarian politics. That we're now seeing spill over into other countries. It's happened already. So we're starting to see now it affect Latin American countries. We're seeing it on the African continent. It's affecting uptake of the new malaria vaccine, for instance. And so I've met with Tedros a couple of times, Dr. Tedros, who heads the World Health Organization, and he's wringing his hands because now the U.S. is good at exporting stuff, right? We export our movies, our music. Now we're exporting the anti-vaccine movement. And you're starting to see anti-vaccine activists specifically target African countries. For instance, now a so-called documentary, it's a fake documentary, has been released making claims that the Tdap vaccine that you can give in latent pregnancy to prevent neonatal whooping cough and tetanus has been secretly laced with human chorionic gonadotropin to sterilize African women. It's all fake, but the impact, is devastating. So this is what they're doing now.
So Peter, given this, what in a public policy, in an educational sphere, what can the scientific, the medical community do to counter this? What's effective? What are the tactics best used? Lecturing doesn't seem to do it.
Right.
What is needed here?
Yeah, and it turns out going on CNN and MSNBC ain't cutting it either, right? I'm mostly preaching to the converted. I used to go on Fox News, and then I wouldn't go along with the hydroxychloroquine nonsense. I was even going on Tucker Carlson and Sean Hannity, and when I wouldn't go along with hydroxychloroquine, they stopped inviting me. Although Bill Hemmer and the afternoon anchors hung in there with me a little while, and then that ended as well. The groups that we need to reach the most are unfortunately, fairly insulated, and so I know I'm giving you a very long, I don't know the answer to your question answer, but this is what I struggle with more than anything else, and with my colleagues as well. How do we reach these groups? And certainly local public health leaders getting out timely messages. I've designed some infographics now that compare, that anyone can understand, showing the very low risk of such as the MMR vaccine versus the very high risk of measles, because one of the tactics that anti-vaccine groups use is they blow up the side effects and downplay the severity of the illness. And you've heard even that from our Health and Human Services Secretary. But, it's tough to keep up with the disinformation. A few months ago, the Florida Surgeon General, Dr. Ladapo, who's actually a Harvard Medical School graduate, comes out and under DeSanctis, he comes out and says, mRNA vaccines are causing turbo cancers because they're integrating into our DNA, into our genome. So I go out there on the cable news channels. Okay, first of all, there's no such thing as turbo cancer. He just made that up. It's a made-up term. Second, the RNA given and the nucleic acid given in the lipid nanoparticle gets to the cell membrane, into the cytoplasm, but it can't get into the nuclear through the nuclear membrane into the nucleus. Otherwise, you have to use electroporation for that. That's why we have no DNA vaccines. And then, by the way, even if some residual nucleic acid did get into the nucleus, we have proteins of our innate immune system that block integration of foreign DNA. Otherwise, every time you eat a hamburger, you'd have cow DNA integrating into your genome, and that doesn't happen. And the likelihood it's going to happen next to an oncogene is even more remote. So it's, any first-year graduate student in molecular biology, any senior biology undergraduate could debunk that. But it's not a 30-second UNICEF commercial, right? It takes time. And so this is what we're not getting, is the opportunity.
Let me take it finally back to Texas. We know the messaging coming out of the Secretary of HHS. What has the Texas state government, the governor, the lieutenant governor, what has the Department of Health said, either statewide, Lubbock, West Texas, about vaccines and the reasons for this outbreak, and most important, how it can be contained today, not as a future policy issue?
So, I think it's mixed. I think the local and state health departments, they're really good and they're very committed, and they are working overtime because, There's nothing more difficult than a measles epidemic because it's so highly transmissible. It's almost, when it gets to a certain threshold, you can't even do contact tracing anymore. I can't fault anything they're doing in terms of their setting up vaccination clinics, making vaccines accessible. That's not the issue. And I've served on 2 Texas governors' task force, Rick Perry and Governor Abbott. They are not anti-vaccine. I mean, they're all in, and even the Lieutenant Governor Dan Patrick's all in. But they could be out there more, right, in terms of talking up vaccine.
Peter, my last question to you before we turn to the audience for their questions is a public service message. Is it too late if you haven't been vaccinated to receive a vaccination, child or adult? How rapidly does the vaccine take effect to provide immunity?
It's never too late to get vaccinated. In fact, this measles vaccine is so good, even if you've been exposed to the virus, if you vaccinate within 72 hours, you can either stop the infection or at least greatly mitigate its impact. So the point is, it's never too late to get vaccinated.
If you were vaccinated as a child, is there any value to a new vaccination?
So I actually did, because I was traveling to a lot of measles endemic areas globally, so I got a second immunization. So if you were starting in the late 1980s, kids got 2 vaccine doses, one at 12 months of age, another one at 4 to 6 years of age around school entry. So those kids are fine. If they say if you're born before 1957, there was so much, measles was ubiquitous, and everyone was exposed, and so that gives pretty good protective immunity. The window period is between 57 and the middle 1980s. Chances are you got a single dose of MMR vaccine, and which gives pretty good protective immunity. It's around 90% protective immunity, and the answer is, if you're here in Houston and going to the Baker Institute and all of their events, you're probably okay. If you venture,
there are other health risks here. Yeah.
if you venture into West Texas, where there's a lot of measles transmission, for work or business or whatever, or family reasons, I would get another dose. If you're going to known measles endemic areas on the African continent and elsewhere, I would get another dose. The other option is you can actually have measles antibody titers drawn to see if you already have immunity, but I find it easier to get the second dose. The only asterisk on that is the difference now is a lot of people are on biologics therapy, monoclonal antibodies like Humira, that can suppress the immune system, and you may or may not be able to get live virus vaccines like the MMR, and you should have or if you're on a checkpoint inhibitor for cancer chemotherapy or for autoimmune disease, you might want to have that discussion with your physician, or if you're pregnant, you don't want to get a live virus vaccine.
Okay. Peter, I'm going to turn to questions received from the audience. Given the impact of either suspended grants or outright cuts imposed on funding to the national health bioscience-related institutions, how can public healthcare workers continue to do their job? Keep the faith was the actual language here.
Yeah, it's going to be very hard. I mean, the proposed cuts to the indirect costs of the NIH are pretty devastating. It essentially translates, because Texas is one of the largest recipients of NIH grants, and of the $2 billion of NIH grants that go to the state of Texas, half of that goes to the institutions in the Texas Medical Center. So and Texas Medical Center is a huge contributor to the economic engine of Houston and Texas. And it could translate into $100 to $200 million in annual losses to the Texas Medical Center institutions, which the only way you can manage that would be massive layoffs of highly skilled, well-trained workers. So it would have a wrenching impact on the economy.
Peter, talk to us about something we haven't discussed. What's under research right now? What could sustained funding and support produce as you look at the next 5 to 10 years of vaccine or disease-related research?
Well, for instance, we've been making sort of inexpensive traditional recombinant protein vaccines, and it's reached 100 million people. They're great vaccines. But there's certain things that technology can't do, and that includes, for reasons we probably don't have time to go into, making a cancer vaccine. So there's been a recent breakthrough now for pancreatic cancer, which I've lost, probably many of you have lost loved ones or good friends to pancreatic cancer. It's a devastating condition. Now, a really exciting result out of Memorial Sloan Kettering Cancer Center in New York has found an mRNA cancer vaccine that's working, a therapeutic vaccine, basically a treatment. And now we've teamed up with the Baylor Cancer Center looking at a triple-negative breast cancer mRNA vaccine. We've got to do now a full-on push for this. This really, I think, is going to be a breakthrough. But what are we doing? We're having discussions now in various state legislatures about banning mRNA technology for ideological Florida Surgeon General Latipo reasons, or even doing this at the federal level, in addition to the cuts. So those are the kinds of things we have to find a way to let cooler heads prevail and allow these treatments to proceed.
And Peter, that triggers not a question from the group, but a question I've seen in the public space, that vaccines are made from cells taken from aborted fetuses.
Well, first of all, ours uses microbial fermentation in yeast. We use the same process that the St. Arnold's Brewery on I-10 uses. It's microbial fermentation, except instead of making alcohol, they make recombinant proteins. So not all do, but certain vaccines require human cell lines, and they were derived initially from either one of two aborted fetuses, one in the 1970s, one in the 1980s, and they've propagated those cell lines over decades. So it's not as though there's aborted fetal material in there, right? It's a cell line that's been propagated in certain types of vaccines, which the Vatican has opined on and has given the green light for and everything else. But we do have to provide that education.
What motivates, this is a tough question, what motivates the anti-vax movement? What do they gain?
Well, part of it is the health wellness influencer industry. It's a multi-billion-dollar industry, right? And they are, pushing their nostrums and things like this as alternatives to vaccines. Or in some cases, they are just making things up. Like this one company is selling something called spike protein detox, claiming that, if you got vaccinated, you're giving off spike protein and they're going to detoxify. It's all phony baloney nonsense. But they're selling it, and it's a multi-billion-dollar industry. That's one side. And then the other, and this convergence, is this libertarian philosophy that has been pushing back up against vaccine mandates, which you can kind of understand, especially for adult vaccines. And I have less of a problem with that, is the fact that unfortunately they went the next step to falsely discredit the effectiveness and safety of the vaccines. In their zeal to push back against mandates, they cross the line and now work overtime to falsely discredit the effectiveness and safety of vaccines. So you saw this, for instance, at the CPAC conference of conservatives in Dallas in July 2021. At the start of the Delta wave, Matthew Cawthorn, the representative from North Carolina, said first they're going to vaccinate you and then they're going to take away your guns and your Bibles. Okay. I know it's ridiculous, but people in our state of Texas accepted it. I have less of a problem with that than what they then did. They brought on all the most toxic anti-vaccine activists to falsely discredit the vaccines themselves and say they don't work, they're not effective, they're only political instruments of control, because people buy into that. And that's what Fox News did every night. And people went down that rabbit hole and bought it. And Joe Rogan started pushing ivermectin as an alternative. So it was a combination of health and wellness, influencer industry making money, and this need for political adopting it is one of the part of the platform for political control. And what I say is, look, you're entitled to your political beliefs. Don't adopt this one. Park that one aside, because that's what's going to injure you and your family. But it's very hard to thread that needle in this heated environment.
Peter, to what extent was the national experience with COVID an accelerant, not the originator of, but an accelerant to the doubt, the lack of trust in science, in your view?
Yeah, well, this was, one of the things that I'm often asked about is lack of trust in science. And unfortunately, too much of the narrative is that somehow the scientists screwed this up and we lost the trust of the public because we didn't communicate properly. And one of the things I'll say is, look, during a pandemic, you're never going to be perfect. There were missteps, but not enough to have that label. What the real problem was, you had organized opposition to science and targeting scientists and deliberately creating the mistrust for purposes of political gain. Let me give you an example. Unfortunately, it's our current NIH director, Dr. Bhattacharya, was a talking head on Fox News. He's an MD, PhD economist, not really a scientist, and he's never done a residency. But he's a professor of health economics at Stanford Medical School. So he gets on there and he starts going after me. He says, I'm in a secret cabal with Fauci because I have funding from the National Institute of Allergy and Infectious Diseases of the NIH. That's what he says. And I'm looking at this, I said, what the hell, Jay? Your whole microbiology department at Stanford is funded by the National Institute of Allergy and Infectious Disease. But it was something that gave me an idea, which is that when we talk about science literacy in K through 12, we're all focused on the content, and yes, we have to teach the second law of thermodynamics, but we also have to teach the processes of science, what an NIH grant is, how it doesn't go to me, how it's not a backroom deal, it's done through a study section, it's very competitive, it goes to the institution, not the individual. That has to be done. And part of that also is we need higher visibility as scientists. My friends at Research America, a policy group, do these surveys every couple of years. And they ask the question, can you name a living scientist? That's the question. It turns out the numbers are always the same. 75% of Americans cannot name a living scientist. We're struggling over major revisions of papers and submitting grants and scientific meetings, and we're basically invisible. And by that and part of it is also the fault of our university leaders, especially at academic health centers, who are so worried about protecting the brand of the institution that they really don't want their scientists and docs speaking out. So that creates a vacuum. So we're invisible, and that allows the bad actors to then portray us as cartoon villains or doing nefarious things in white coats and making viruses and at the World Economic Forum and all this other kind of stuff. It's
George Soros.
Yeah, right. Yeah, they've got me in there with, apparently every weekend I'm in Davos with George Soros cooking up viruses.
Well, Peter, the challenge here is not just how do you deal with an epidemic phenomenon in a combination of public policy and application of sound medicine. It's the broader, I think, more important strategic question of how do you build trust and confidence in critical reasoning, in the products of critical reasoning, in science itself, in an understanding of what has been achieved and how it was achieved, and what can be achieved with appropriate support, which does mean funding. Whether it leads to a successful outcome or not, it's part of the process. But if you interrupt it, you lose pace, and it's not just a public health issue, it's also a national security and an economic issue, because others will pick this up.
Absolutely. And this is why when I came to the Texas Medical Center, part of the deal was I want to be linked with this thing called the Baker Institute, because that's going to be as important as actually being in the laboratory and making vaccines. And we've got to send that, we've got to kind of universalize that message more, that if we don't shape the policies around it, we're going to wind up in this situation like we are now in West Texas with a devastating measles epidemic, or 40 to 50,000 Texans needlessly dying because they refused COVID vaccines.
Peter, thank you again for all that you continue to do.
Thank you so much.
Baker Briefing is brought to you by the Baker Institute for Public Policy, which provides meaningful, nonpartisan policy analysis on the most critical challenges facing the United States, Texas, and the world. This episode was produced by Karina Zamel with support from Grayson Beaubien. AV production was led by Kevin Young. Again, if you'd like to watch our full event with Peter, you can click the link in the show notes. To learn more about our work at the Baker Institute, be sure to visit us at bakerinstitute.org. Thank you for listening.